So on June 13, 2012, a 60-year-old man was sent to a private hospital in Jeddah, Saudi Arabia. He had a fever for 7 days and had been experiencing symptoms such as cough, shortness of breath. He had an elevated blood pressure and a heart rate, but had a normal respiratory rate of 20 breaths per minute. He was transferred to the intensive care unit on the day he arrived at the hospital and received mechanical ventilation. 11 days after admission, the man died of respiratory and renal failure. And that was the first reported case of MERS and the case in which the MERS coronavirus was isolated and examined. So, to get a clear insight of the virus and the disease, I will be focusing on three main components. First, I'll talk about the medicine and the disease itself, including how it spread, the symptoms, and how long they last for, as well as some possible treatments and preventions. Next, I will look at molecular biology and virology and really dive into the details of its structures, how the virus affects the host cell and its life cycle. And lastly, I will talk about the public health and epidemiology of the disease. This section will cover the geographic prevalence, the yearly reported cases, and mortality rate, as well as some associated risk factors that affect the severity of the disease. So let's start with the name. So MERS stands for the Middle East Respiratory Syndrome. This disease is caused by Middle East Respiratory Syndrome coronavirus or MERS coronavirus. It is in the family of Coronaviridae. So now that we know its name, let's take a look at how the disease is spread. So MERS is a zoonotic disease, which means that it spreads from animals to humans. In most reported cases, infection of coronavirus was caused by direct or indirect contact of sick dromedaries, which is a type of camel from Saudi Arabia. However, human-to-human transmission is also possible, but majorly in healthcare settings where healthcare workers are in close contact with infected patients. Once the virus arrives at the human body, there are multiple tissues and organs in which it can infect. MERS coronavirus can infect bronchial epithelium cells, which are cells in the respiratory airways in the lungs, as well as the lung parenchyma, which is the area in the lung with the alveoli for gas exchange. It can also infect endothelial cells, which are cells in the heart that regulate exchange of blood streams in the surrounding tissues, and it also infect other organs such as livers, kidneys, and intestines. The incubation period of the virus varies from 2 to 14 days, with a median of 5.2 days. And after the incubation period ends, then the symptoms start appearing. And there is a large variety of symptoms that can be present in a patient infected with MERS just because of the different tissues and organs that it can infect. Some general symptoms include fever, body aches, and lethargy. And if we look at more specific symptoms in specific parts of the body, symptoms from the central nervous system include headache and confusion. And symptoms from the lower and upper respiratory tract include chest pain, sore throat, cough, shortness of breath, runny nose, and etc. Symptoms may also be present in the gastrointestinal tract, including nausea, vomiting, diarrhea, abdominal pain or discomfort, and etc. Usually, these rather mild symptoms start appearing after the incubation period, which is around 5 days after the exposure to the virus. And now, depending on each individual case, the severity of the symptoms also vary. Some may be even be asymptomatic or have mild or general symptoms, like I mentioned earlier. However, there are complications that emerge as the symptoms of MERS develop. The most complication is pneumonia and can lead to respiratory failure. Other extrapulmonary complications may also be present, such as septic shock or kidney injury. Now that we look at the symptoms, let's take a look at some treatments and preventions for MERS. So unfortunately, there is no effective approved treatment that is publicly available. Most patients with mild symptoms recover themselves with the help of common medicines such as ibuprofen or Tylenol for the pain and fever. Those with severe symptoms may require more specific treatments, such as intravenous fluids to help the body stay hydrated, oxygen to make up for possible respiratory failure, or vasopressor medicines to raise the blood pressure and prevent a shock. For incredibly ill patients, ICU admission is needed. Usually, for those patients, the median time from the start of the symptoms to admission in ICU is around 5 days, and to death is approximately 12 days. Well, now it does sound like a shockingly short amount of time. So, are there effective ways to prevent it? And unfortunately, the answer to that is no. The most effective and accessible way of preventing a disease, which is the vaccination, is also not available in this case. But just as a general precaution, avoid eating unprocessed camel milk or raw camel meat. Avoid touching sick animals or dromedaries, and avoid going near areas in the Peninsula. And of course, washing hands frequently and making sure they are clean before touching the mouth or nose is always a good idea. All right, now that we learned quite a lot about the disease itself, let's zoom in and take a look at the virus itself, which includes its structure and how that helps it infect human cells and what exactly it does in human cells within its life cycle. So, starting with its structure, the MERS coronavirus is a spherical virus with a diameter of around 100 nanometers, which is relatively large. It is a single-stranded positive sense RNA virus, and it is enveloped with spike proteins. So other than the spike protein, it has three other main structural proteins, which are the membrane protein, envelope protein, and nucleocapsid protein. Each of them serve a crucial role in the viral life cycle. Starting from the inner part of the virus, the nucleocapsid phosphoprotein in pink binds the RNA uh, binds to the RNA genome and does the job of RNA binding, synthesis, and translation. The membrane glycoprotein in brown serves a major role of viral assembly by supporting the formation of the envelope and the core of the virus by interacting with the nucleocapsid protein. The envelope protein in purple does the job of intracellular trafficking, which is the transportation of proteins, vesicles, and organelles. It also does the job of host recognition and virus spreading. Lastly, the spike protein plays the role of virus binding, fusion, and entry to the host cells. The spike protein is divided into two subunits, S1 and S2. The S1 subunits plays the role of binding the virus onto its receptor, while S2 does the job of fusing the virus into the host cell. So with that in mind, let's start taking a look at the viral life cycle. So here's a diagram. And if we start with the top left corner, we can see that the virus approaches the cell body and the spike protein binds to the DPP4 receptors and it fuses the virus into the cell body and the RNA is released. The released RNA then goes into the ribosome for translation into two large proteins called ORF1A and ORF1B. And the two large proteins will then be cut into smaller pieces, and these smaller pieces come together and form replication translation complexes. And these complexes then associate with the double membrane vesicles, which is this orange circle here, or also called DMBs, and then it goes on two paths. So first, if the transcription regulation sequences, or the TRS, which is the blue circles here, from the RNA is recognized by the complexes, then a shorter discontinuous RNA will be generated, and these discontinuous RNAs will be transcribed and translated into structural proteins. And the other path is that if the TRS is not recognized by the complexes, then the continuous longer pieces of RNA will be synthesized, and these pieces will be used later for replication. And afterwards, the replicated RNA will be encapsulated in the nucleocapsid protein, and the other pieces of structural proteins will be inserted into the rough endoplasmic reticulum, or the RER in this section here. And they together will be transported to the ERGIC, where they start their assembly. And afterwards, they are transported into the Golgi body, where they further assemble and mature. And afterwards, when they leave the Golgi body, they will obtain a layer of vesicles, which then will transport them to the cell surface, and they will undergo a process called exocytosis. And this is where the vesicle carrying the viral particles fuses into the cell membrane, and the virus leaves the cell body. After replicating in the host cell, the virus harms the host cell, and the harm it causes is referred to as the cytopathic effect. The main cytopathic effect of MERS coronavirus on its host cell is the shedding of TPP4. As TPP4 receptors are also found on crucial immune cells, the shedding of TPP4 inhibits the optimal performance of those cells, which results in severe infections and inflammation. All right, now that we have zoomed in and examined the virus at a microscopic level, let's zoom out and examine its impact on public health and its epidemiology. As you might be able to infer from the name, MERS is a disease that originated and it was most prominent in the Middle East area, specifically around Arabian Peninsula, with the original country being Saudi Arabia. Numerous cases have also been reported in nearby countries such as Iraq, Kuwait, Qatar, United Arab Emirates, Oman, Yemen, Jordan, and so on. The major cause of transmission between countries is trade and visits, where an infected person or people brought the disease from one place to another, and reported cases from outside of the Middle East region were also mainly caused by the same reason. In 2015, there was an outbreak of cases in South Korea, which was the largest outbreak outside of the Middle East that has been reported. There were 186 reported cases and a total of 38 reported deaths. The reason that MERS didn't spread globally is mainly because of the limited chances of human-to-human transmission compared to other coronaviruses. And to get a clearer sense of the distribution of the disease, here's a graph of the total reported cases up to the start of 2020. The large circles represent more reported cases in the country, and as you can see, there's a much higher concentration of circles in the Middle East area, with an outlier in South Korea, which refers to the outbreak in 2015. And before moving on to the reported cases, I'd like to introduce a scenario that ensures a representation of an accurate image of the reported cases. So here on the screen is the latest report on global MERS cases. And as you can see, there is a dramatic decline of reported cases from 2019 to 2020. And this trend continues to this year, where there were a total of 205 reported cases in 2019, but only 59 reported cases in 2020. Hence, I will only be focusing on the reported cases and reported deaths from the year of discovery, which is 2012, to the year before the virus became inactive, which was 2019. Since its isolation in 2012, there have been a total of 2,502 reported cases and an average of 350 reported cases per year. Among them, 861 total deaths were reported, which is an average of 130 deaths per year. There was an outburst in 2014 with 662 reported cases in that year. And just as the number of cases increased in that year, so did the number of deaths. And there were 290 reported deaths in that one year. And this gets us to a mortality rate of around 35%. There are no particular trends within the virus active years, and because as you can see on the graph, the reported cases increase and decrease without any particular pattern. One major risk factor of being infected is working at a healthcare facility, like I mentioned earlier. And among the limited human-to-human transmission of MERS, being close contact with infected patients is a major cause. When working at healthcare facilities with expanded close contact with sick patients, the chance of being infected increases dramatically. Out of the yearly reported cases, almost 20% of the cases are healthcare workers. There are also pre-existing conditions that might make symptoms more severe, and those who require an intensive care unit usually have a history of respiratory tract illness, diabetes, heart diseases, or other chronic health conditions. So, just to summarize things up a little bit, the MERS coronavirus is mostly spread through interactions with sick animals, but human-to-human transmissions are also possible. Symptoms vary greatly from asymptomatic to severe symptoms leading to death, and the virus infects cells from multiple organs, and there are no treatments or vaccinations available. It is a spherical structure with spike protein, and it is a short-lived disease, and it was only prominent from 2012 to 2019. And it is most common in Saudi Arabia and has spread to nearby countries through trade and visiting. And there was also an outbreak in Korea in 2015. And thank you.